Hello everyone, I am Assistant Professor Dr. Normina Ahmad Bustami and I am here today to discuss with you on nutraceuticals for the skin. In this lecture, I will touch on some of the nutrients and their properties which are beneficial for the skin. This lecture is brought to you by School of Healthy Aging, Medical Aesthetics and Regenerative Medicine, UCSI University. Skin is the body's largest organ and it protects against microorganisms, chemicals, and ultraviolet radiation. Consequently, the skin may suffer alterations such as photoaging, immune dysfunction, and inflammation, and this may significantly affect the human health. Water is a nutrient which is often overlooked. To care for the skin, we need to drink at least 8 glasses of water per day. This will keep our skin moist and makes fine lines and wrinkles less noticeable. It also helps the cells to take in more nutrients and get rid of toxins. In addition, it helps with blood flow and keeps the skin glowing. Looking back at the history of medicine, Hippocrates has introduced the concept of food as medicine with his quote, "Let food be thy medicine and medicine be thy food." And the philosophy behind it is to focus on prevention. In incorporating food in medicine, scientists tried to look at nutrients and the possibility of adding nutrient in patient management. And this brings forward the term nutraceutical. This term derived from the combination of nutrition and pharmaceutical, and this is established by Stephen DeFelice in 1989, who is the founder and chairman of the Foundation for Innovation in Medicine, Cranford, New Jersey. Nutraceutical is defined as a food or a part of it that provides medical or health benefits, including the prevention and or treatment of a disease. Nutraceuticals may be used to improve health, delay the aging process, prevent chronic diseases such as obesity, increase life expectancy, or support the structure or function of the body. Scientists have found that using nutraceutical in patient management is a promising strategy for preventing, delaying, or minimizing premature aging of the skin and alleviate certain skin disorders. And this strategy uses nutrients as ingredients for management of skin conditions. Supplementation with nutraceuticals has shown positive effects on the signs of aging and protection against UV radiation aging in several human trials. However, extensive and comprehensive trials must be done to build credible scientific evidence for skin nutraceuticals and to establish a cause-effect relationship between the ingredients and the beneficial effects for the skin. Nutraceuticals are not only used for skin disorders, but has also been used to treat specific diseases. This table showed some medical conditions and the nutraceutical used to treat these medical conditions. Some notable examples are glucosamine, chondroitin, and methylsulfonylmethane, which are used in the treatment of osteoarthritis, neck, back, or joint pain, in which the incidence of use is more than 25%. Some nutrients have been linked to skin health. One of them is collagen peptides. Peptides are short polypeptide chains formed by few amino acids and with a low molecular weight. Since some of them carry out critical biological activities, these are generally known as bioactive peptides. Peptides used for cosmetic purposes are typically derived from collagen with improved bioavailability and solubility compared to whole protein. Bioactive peptides have been used in several nutraceutical formulations, claiming anti-aging and skin reaffirming properties. Hydrolyzed collagen has been used in food supplements and pharmaceutical industry due to its bioavailability, rapid absorption in the digestive tract, passage into bloodstream as small peptides, and accumulation in the skin 96 hours after ingestion. After ingestion of hydrolyzed collagen, proline and hydroxyproline were found in the bloodstream. With low molecular weight and rapid absorption, collagen peptides are distributed in different tissues such as skin, where these peptides have demonstrated their efficacy and benefit. Antioxidants are important for healthy cells and helps to slow and prevent free radical damage. Examples of antioxidants are polyphenols and flavonoids, and these are available in fruits and plant-derived beverages such as fruit juices, tea, coffee, and red wine. Colorful fruits and vegetables like berries, tomatoes, apricots, beets, squash, spinach, sweet potatoes, tangerines, peppers, and beans are also good sources of antioxidants. Selenium is an essential micronutrient related to the action of glutathione peroxidase and thyroidoxine reductase, and these enzymes are involved in defending against oxidative stress. Selenium also acts as an endogenous antioxidant in tissue oxygenation and protects against lipid peroxidation and neutrophils' phagocytic activity. It's also active in the regulation of thyroid hormones, DNA synthesis, and cell proliferation. Zinc is an essential element of the human body, and the skin is rich in zinc. It serves as a catalyst for the enzymes responsible for DNA replication, gene transcription, and protein synthesis to neutralize free radicals. Similar to selenium, it participates in the endogenous antioxidant system and plays an important physiological role in the immune response and wound healing. In studies with human fibroblasts, zinc performed its protective function against the cytotoxicity induced by ultraviolet radiation and lipid peroxidation. It is indicated for treatment of acne and periodontitis and for its photoprotective effects on topical use. Carotenoids are naturally occurring pigments and can be found in algae, photosynthetic bacteria, and plants providing red, orange, and yellow coloration, and these are available in human diet in the form of fruits and vegetables. Alpha-carotene, beta-carotene, beta-cryptoxanthin, lutein, zeaxanthin, and lycopene are among the most common dietary carotenoids. The main biological activities of carotenoids are related to cardiovascular diseases risk reduction and also to maintain optimal visual function. Carotenoids are also beneficial for skin health, especially for photoprotection purposes. Several studies have demonstrated the capacity of carotenoid supplements to prevent UV-induced skin damage in human volunteers. Beta-carotene is the most abundant and efficient precursor of vitamin A. It is a liposoluble antioxidant whose main activity occurs in collagen and elastin fibers. It is derived from natural food sources such as carrots, tomatoes, spinach, sweet potato, other yellow and green vegetables, fruits, and seaweed. It inhibits the peroxidation of lipids induced by free radicals. However, in those who smoke tobacco, it can increase the risk of lung cancer. Beta-carotene is used for the prevention of sunburns and photo damage, psoriasis, vitiligo, and hairy leukoplakia in adults. Lycopene is a liposoluble carotenoid and a powerful antioxidant found in some red foods such as tomatoes, guava, watermelon, papaya, and cherry. It has a strong ability to attach to single oxygen and has been suggested for the prevention of carcinogenesis and atherogenesis and to protect molecules such as lipids, low-density lipoprotein LDLs, proteins, and DNA. It has protective properties against erythema induced by UV radiation and photoaging mediated by oxidative stress. Lutein is another carotenoid which is often used for its antioxidative properties. Lutein accumulates preferentially in the macula lutea, protecting the retina from oxidative damage from ultraviolet radiation. It has antioxidant, anti-inflammatory, photoprotective, and anti-carcinogenic properties, and it also acts to improve skin elasticity. The main natural sources of lutein are green vegetables such as kale, spinach, celery, lettuce, and fresh herbs. Use of lutein with zeaxanthin provided greater antioxidant functions and better hydration for severe skin compared to isolated treatments. Coenzyme Q10, or CoQ10 in short, is a natural compound of food and is often used in both functional food and supplements. It is an endogenous lipophilic compound and is an essential component of mitochondrial energy metabolism, an effective antioxidant, and presents a range of putative benefits for human health. CoQ10 can be found in fish like salmon and tuna, poultry, organ meats like liver, and whole grains. CoQ10 is present in all living cells of the body, where it acts as an important antioxidant and is also active in the mitochondrial respiratory chain. However, endogenous production of CoQ10 decreases after the age of 20 and is reduced in myocardial cells. CoQ10 acts on oxidative stress and is indicated for prevention and treatment of fine lines and wrinkles, but it also aids in the treatment of heart failure and fibromyalgia. Vitamins are organic compounds which are essential nutrients for humans. Required in limited amounts from diet, it belongs to different structural families. Vitamins have several roles in skin health, including antioxidant activity, sebum and keratinization regulation, collagen synthesis, and photoprotection. Vitamin C is one of the vitamins usually used in aesthetics. It acts as an antioxidant, neutralizing reactive oxygen species that are produced by cells of the dermis and epidermis, protecting the intracellular structures from oxidative stress. It is also a cofactor for the production of collagen fibers and participates in the inhibition of biosynthesis of elastin in fibroblasts. When used with vitamin E, it acts synergistically, working with its mechanism of transformation. It is indicated in the prevention and treatment of photodamage. Vitamin C is available in bell peppers, citrus fruits, papayas, kiwis, broccoli, greens, and Brussels sprouts. Vitamin E is a lipophilic antioxidant and is usually found in the form of tocopherols. It is an important binder of peroxy radicals, preventing lipid peroxidation of polyunsaturated fatty acids. It is indicated for preventing photodamage, sunburn, chronic cutaneous lupus erythematosus, and atopic dermatitis. Vegetable oils, nuts, seeds, olives, spinach, and leafy greens are among the sources of vitamin E. Polyunsaturated fatty acids have been traditionally considered beneficial for human health. Polyunsaturated fat or POFA are divided into omega-3 and omega-6. Their biological activity is especially relevant to cardiovascular and other inflammatory diseases. Omega-3 is a long-chain polyunsaturated fatty acid found mainly in fish such as salmon, tuna, and cod. It acts on cyclooxygenase and lipoxygenase and in leukotrienes, having a positive effect on blood flow and anti-inflammatory and antioxidant properties. It also acts as a regulator of physiological functions of the skin, such as inflammatory responses, platelet aggregation, vasodilation, and cell proliferation. It has been used in conventional treatments of various diseases, such as cardiovascular disease, hypertriglyceridemia, atopic dermatitis, psoriasis, and acne vulgaris. Current interest in research involves use of prebiotics and probiotics in modulation of skin microbiota. Probiotic is defined as living microorganisms which, when consumed in adequate amounts, confer a health effect on the host, while prebiotic is a non-viable food component that confers a health benefit on the host associated with modulation of the microbiota. UV exposure is known to negatively affect immune system functions, and clinical studies that use probiotic bacteria to modulate the cutaneous immune homeostasis altered by solar-simulated UV exposure in humans suggest that certain probiotics may help preserve the skin homeostasis by modulating the skin immune system. In short, connection between nutrition and the skin, as well as the effect of nutrition on skin aging, has been an interesting research field for scientists. Studies have demonstrated that well-regulated lifestyle with low stress conditions, drinking enough water, and a balanced nutritional diet including antioxidants-rich food to be beneficial in the fight against free radicals and skin aging, as well as other skin conditions. Thus, it is worthwhile for scientists, health practitioners, and members of the public to expand their knowledge on nutrition and nutraceuticals that benefit the skin and the body for an overall healthy well-being. These are my references for this lecture. This lecture is brought to you by UCSI University. School of Healthy Aging, Medical Aesthetics and Regenerative Medicine UCSI would like to introduce to you the Master of Science in Healthy Aging, Medical Aesthetics and Regenerative Medicine. The Master of Science in Healthy Aging, Medical Aesthetics and Regenerative Medicine is accredited by the Malaysian Qualifications Agency under Ministry of Higher Education. UCSI is the first university in the world to offer a postgraduate program addressing all three fields, healthy aging, medical aesthetics, and regenerative medicine in one program. It is the only master's pathway to obtain the Letter of Credentialing and Privileging LCP in Malaysia. This program is guided by subject experts with access to latest aesthetics equipment and free hands-on session provided for the students. The School of Healthy Aging, Medical Aesthetics and Regenerative Medicine has received students from all over the world, with more than 80 students from 12 countries. The students come from all walks of medical discipline, from subspecialist to medical officer. This program has an almost 100% passing rate. Throughout the years, we have more than 150 graduates since 2013. Our program covers different topics in all three fields in healthy aging, medical aesthetics, and regenerative medicine. Under Healthy Aging module, we cover exercise prescription, balanced diet, stress reduction, hormonal enhancement, and supplementation. Under medical aesthetics, topics such as injectables, light and laser, radiofrequency, chemical peels, and microdermabrasion will be discussed. Regenerative medicine include topics such as genetic engineering, stem cell therapy, cloning, artificial organ, and nerve impulse continuity. The entry requirement for this program for local student includes MBBS or equivalent degree and valid annual practicing certificate. While for international students, the students require medical degree, valid practicing certificate issued by their own medical council, and IELTS Band 6 or TOEFL 550. Students graduating from this program have a few options or career prospects. They can start a wellness center or aesthetic clinic, or practice and work in established aesthetic or wellness centers, embarked on a career in education field, or involved in research field by becoming a researcher or by furthering their education to a higher level. Financial aids are available to students in this program. To date, approximately 150 million ringgits in scholarship and study assistance have been awarded in the university. And this figure has been on the rise since 2011.
I'm Dr. Malini. Currently, I'm attached to Institute Jantung Negara, but I do part-time locums in clinic True Care in Sentul. Okay, I chose this field because I'm planning to venture into aesthetics field in future. And UCSI actually, at that time, they offered this full, just not a degree or a diploma, it offered masters, and it carries more weight lah. Nice environment, we have a very good lecturers, a lot of hands-on. The classes are very, how to say, we are able to converse with the lecturers, so it was a fun as well as educational.
Good afternoon, I'm Dr. Sundaraj. I'm working in Gleneagles Ampang Hospital in ED department. It's nothing about medication alone. It's also about your way of your life, changing pattern of your life, the food you take, knowing your body more, and your mindset. So when I was Googling, UCSI was offering a good deal at that point of time, together with two other master's program, which is healthy aging and then regenerative medicine, which I have very minimal knowledge on that. So it was a good opportunity for me. The teachers were very supportive and encouraging, and they were all the way to teach you and guide you in all purpose. I had a derm lecturer, in aesthetic, and yeah, she was very helpful, and other lecturers was very open-minded, like very helpful. As a doctor, we are based on medications, okay? We treat patient through medications. Our knowledge through diet, way of life on physical activities and keeping yourself healthy, your hormone changes according to your age, how to benefit with the supplements. I, as a person, as a doctor, I was having a very lack of knowledge on that. When I was introduced to all the subjects when we were going through it. It's really helped me to treat my patients, okay, in a different dimension, different angle, not only through medications, but to teach them the way of healthy living, to say that you can get old healthily without disease. I'm not only prescribing medication for the patients, but I'm also teaching them to live healthy, to look forward to get aging healthily. And yeah, and I also apply to myself. Being a student back, very flexible, very knowledgeable. UCSI is different from others. They also have regenerative medicine, which is totally different from aesthetic. And they also have healthy aging program, which is really another side of medicine where very less people knows about it. Yeah, it's a good choice if you choose this program in UCSI.
If you have any inquiry or would like to know more about us, please email us at shamam@lies.ucsuniversity.edu.my or call us at 03 9101 8880. Scan this QR code to follow us on Facebook for updates on our events. Thank you for your attention.